Our top story, falling through the cracks of Obamacare. One Nevada man signed up for health care on his state's exchange. He paid his premium, but when he suffered a heart attack and underwent triple bypass surgery, he was stuck with the bill. I'll let Larry Bassich here to tell his story, just how much that bill was. Joining him, Avik Roy of the Manhattan Institute. Welcome to you both. Larry, this story, amazing. What kind of bill did you get?
Well, I've received several bills. The bill that everybody sees on television and the newspapers, the $407,000 bill, that is the one that came from Summerlin Hospital, the hospital where I had my surgery. But I also have 6 or 7 other, as you probably know, maybe you don't, but 6 or 7 other doctors, such as emergency room and anesthesiologists, x-ray folks, those kind of folks.
It all adds up.
Yes, it does, and it's not on that $407,000 bill. It's in addition to that, yes.
Well, Larry, tell us about this story, because you tried to sign up for Obamacare right away. What happened?
I started on October 1st. I was told on October 1st, come back in a week. I came back in a week, and still it was a mess. So what happened was I kept coming back, and coming back. And what happened is that probably around October 23rd or so, something like that, and this is after, I won't say hundreds, maybe 50 phone calls to the Nevada Health Link site, and many, I'll say 100 hours of computer time trying to get through. Yes, I finally got through to make a payment, but the payment option didn't work. So I said, well, okay, what I'll do from now on, instead of worrying about making a payment, because I don't think it's ever going to work, I'll look at the plan. So I examined the different plans. I examined probably 6, 10, 20 different plans. But I actually went through the application process on maybe 3 or 4. Now, what they ask in the Nevada Health Link site is that you supply proof of citizenship and also proof of income. So I had to fax them or email them a copy of my birth certificate and my 1040 IRS form. Well, I went ahead and did that and tried to do it. Failed. The site failed miserably in even taking that email. So it wasn't up until November 7th or so that I finally got that information to them, the birth certificate and also the IRS 1040 form. But it wasn't until November 19th that I actually was able to get on the payment page where I could make a payment. On November 19th, 2013, I made a payment for the full premium of the health insurance plan that I wanted. And on November 21st, I got my confirmation number. You know, like when you do a check thing, transfer of funds, you get a confirmation number.
It sounds like you thought that you had coverage.
As of November 21st, I thought I had absolute coverage. And so I just sat. And I waited. I figured, well, that's what I've been promised. You make your payment, make it by December 23rd, and you get your health insurance. Go on to December 31st. Again, I'm making calls. I'm getting anxious.
Wait, I want to stop you there for a second, Larry, because I want you to tell the part of the story. They actually took the money out of your account, right? I mean, you paid.
Yes.
You paid the money.
Yes, I paid. I paid the money. I paid the full premium for January of 2014. That's correct. And they accepted payment on November 21st.
Let me bring in Avik Roy here for just a second. Let me interrupt your story. I apologize for just a second. And I want to talk to Avik. He's an expert on this stuff. He's been looking at Obamacare for months and months and months. Avik, you hear his story. Here's a man tries so hard to get coverage, working at it all the time, lots and lots of hours spent, money's taken out of his account, he gets some kind of confirmation number from the website. Does he have coverage?
You know, it's a remarkable story. He should. He's done everything right. And I'd be interested to hear from him whether he was previously uninsured or whether he previously had a plan that he had to shift over into the exchange. Because his senator, Harry Reid, is the one who's going around saying all these horror stories are untrue, nobody is having problems. And it's not just problems with the websites, it's that the plans are so expensive. So people are paying all this money and they're not getting the coverage and the care that they need.
Well, Larry, did you have coverage before? Apparently you didn't, because you're getting the bills for $400,000.
Well, can I mention just one thing? I did have coverage when I left Hawaii with Kaiser. And I don't mean to burst anybody's bubbles or to question anything anybody is saying. However, my premium when I was in Hawaii was about $460 a month. With the subsidies, my premium now is only $160 a month. I just wanted to say that to make sure that you understand what my situation is. Okay, but still, I did not get coverage. The problem is I did not get coverage on January 1. And now, to this date, I have coverage as of March 1st. But all of my bills, all the bills I mentioned were from from December 31st, well, let's say January 3rd is when I started really, that's when I had my bypass surgery. And when the bills accumulated from that point up to, God, I'm going to say $500,000 between the 3rd of January and the 24th of January.
So you had a heart attack at the end of December, and as far as Obamacare was concerned, you weren't covered.
As far as the end of December, I wasn't covered, and believe me, I was happy to. I'll pay anything, because I went to a clinic. The clinic sent me to an emergency room. The emergency room held me there for a stress test. I had a stress test done, and well, I won't get into that. But what I ended up having was the surgery on January 3rd. Had a 4-day recovery period, and then had to return back to the hospital twice because of, I don't know what you would call it, errors and omissions. But at any rate, what happened was that I had suffered additional complications. Once that I had to go back on January 10th through the 15th, and then I had to go back from the 18th through the 24th.
You know, Larry, and I think Avik can probably back me up on this, it's not that unusual with a severe health problem that you're in and out of the hospital, you're in and out seeing doctors, and you're hoping against hope that you're actually covered. Avik, to you, is Larry's story here just the tip of the iceberg?
Well, I think a lot of people, and you've had some of them on your show, who've had this problem of trying to sign up for the insurance, having actually paid and having the money taken out of their account, thinking they have coverage, but no doctor has any record of their new insurance policy, no insurer has any record of it. This is a problem, and obviously if you're in your 50s and 60s and you're more likely to have something happen to you, it's a ticking time bomb. I don't think we've been hearing a lot of stories just specifically like the one that Larry has in terms of having had this problem and then having a heart attack, but we may have more problems like this if they don't get resolved soon.
You know, I mean, luckily a lot of people, maybe they don't have coverage for a while, but nothing happens. For poor Larry here, he actually had a heart attack in between and wasn't covered. Larry, to you, how has this stress affected your health?
Lord, I wish I could tell you. Some people have come to me and said it was the stress of not getting my insurance coverage that caused the actual heart attack.
Wow.
That there's absolutely no way I can prove that. But I don't care. All I'm interested right now is just cover what you promised from January 1st to whatever I've got going now. Please cover that. You're right. I still have meetings with cardiologists. I have meetings with my surgeon. I have meetings with my internist. I have meetings with my primary care physician. There are a lot of people still involved. The heart attack is not just the operation, the triple bypass. It's everything you work on from then on. They've told me up to 8 months is what I'm, right now. Wow. I have a 6-month standing. Yes.
Can I ask you quickly, Larry, how old are you?
I'm 29. No, sir, I'm sorry. I'm 62.
Okay.
So too young for Medicare. And
yes.
And so you signed up for Obamacare. I see the logic of what you did. I'm just sorry you had such a bad experience. And we've got a little over a week till the deadline for Obamacare signups. It's going to be interesting to see how that goes. Larry and Avik, thanks so much for coming on tonight. Larry, thanks for telling your story on our show. Really appreciate it. Thank you so much.
Thank you so much for having me.
You're most welcome. Most welcome to both of you. Thank you.